Hello and welcome to part two of our third entry in the handbook of signs and symptoms. And last time in audio medical basics we spoke about abdominal pain and we reached the medical causes and we were out of time. So now I'll try to read them. And there are many of course. So forgive me if I go fast. Thank you very much for watching. Please like, subscribe and comment. So, medical causes of abdominal pain. First, abdominal aortic aneurysm. Dissecting abdominal aortic aneurysm. Initially, this life-threatening disorder may produce dull lower abdominal, lower back, or severe chest pain. Usually, abdominal aortic aneurysm produces constant upper abdominal pain, which may worsen when the patient lies down and may abate when he leans forward or sits up. Palpation may reveal an epigastric mass that pulsates before rupture but not after it. Next, abdominal cancer. Abdominal pain usually occurs late in abdominal cancer. It may be accompanied by anorexia, weight loss, weakness, depression, and abdominal mass and distension. Next, abdominal trauma. Generalized or localized abdominal pain occurs with ecchymosis on the abdomen, abdominal tenderness, vomiting, and with hemorrhage into the peritoneal cavity, abdominal rigidity. Bowel sounds are decreased or absent. The patient may have signs of hypovolemic shock, such as hypotension and rapid thready pulse. Next, adrenal crisis. Severe abdominal pain appears early, along with nausea, vomiting, dehydration, profound weakness, anorexia, and fever. Later signs are progressive loss of consciousness, hypotension, tachycardia, oliguria, cool, clammy skin, and increased motor activity, which may progress to delirium or seizures. So next is anthrax, the gastrointestinal anthrax. It's an acute infectious disease. It is caused by eating contaminated meat from the infected animal. Initial signs and symptoms include loss of appetite, nausea, vomiting, and fever. Late signs and symptoms include abdominal pain, severe bloody diarrhea, and hematoemesis. Next, appendicitis. With appendicitis, which is a life-threatening disorder, pain initially occurs in the epigastric or umbilical region. Anorexia, nausea, or vomiting may occur after the onset of pain. Pain localizes at McBurney's point in the right lower quadrant and is accompanied by abdominal rigidity, increasing tenderness, especially over McBurney's point, rebound tenderness, and retractive respirations. Later signs and symptoms include malaise, constipation or diarrhea, low-grade fever, and tachycardia. Next, cholecystitis. Severe pain in the right upper quadrant may arise suddenly or increase gradually over several hours, usually after meals. It may radiate to the right shoulder, chest, or back. Accompanying the pain are anorexia, nausea, vomiting, fever, abdominal rigidity, tenderness, pallor, and diaphoresis. Murphy's sign is common. Murphy's sign is inspiratory arrest elicited when the examiner palpates the right upper quadrant as the patient takes a deep breath. Next, cholelithiasis. So cholelithiasis, patients may suffer sudden, severe, and paroxysmal pain in the right upper quadrant lasting several minutes to several hours. The pain may radiate to the epigastrium, back, or shoulder blades. The pain is accompanied by anorexia, nausea, vomiting, which is sometimes bilious, also accompanied by diaphoresis, restlessness, and abdominal tenderness with guarding over the gallbladder or biliary duct. The patient may also experience fatty food intolerance and frequent indigestion. Next, cirrhosis. Dull abdominal aching occurs early and is usually accompanied by anorexia, indigestion, nausea, vomiting, constipation, or diarrhea. Subsequent right upper quadrant pain worsens when the patient sits up or leans forward. Associated signs include fever, ascites, leg edema, weight gain, hepatomegaly, jaundice, severe pruritus, bleeding tendencies, palmar erythema, and spider angiomas. Gynecomastia and testicular atrophy may also be present. Next, Crohn's disease. An acute attack in Crohn's disease causes severe cramping pain in the lower abdomen, typically preceded by weeks or months of milder cramping pain. Crohn's disease may also cause diarrhea, hyperactive bowel sounds, dehydration, weight loss, fever, abdominal tenderness with guarding, and possibly a palpable mass in a lower quadrant. Abdominal pain is commonly relieved by defecation. Milder chronic signs and symptoms include right lower quadrant pain with diarrhea, steatorrhea, and weight loss. Complications include perirectal or vaginal fistulas. Next, diverticulitis. Mild cases of diverticulitis usually produce intermittent, diffuse left lower quadrant pain, which is sometimes relieved by defecation or passing of flatus and worsened by eating. Other signs and symptoms include nausea, constipation or diarrhea, a low-grade fever, and in many cases, a palpable abdominal mass that's usually tender, firm, and fixed. Rupture causes severe left lower quadrant pain, abdominal rigidity, and possibly signs and symptoms of sepsis and shock, which are high fever, chills, and hypotension. Next, duodenal ulcer. Localized abdominal pain, described as steady, gnawing, burning, aching, or hunger-like, may occur high in the mid-epigastrium, slightly off-center, usually on the right. The pain usually doesn't radiate unless pancreatic penetration occurs. It typically begins 2 to 4 hours after a meal and may cause nocturnal awakening. Ingestion of food or antacids brings relief until the cycle starts again, but it may also produce weight gain. Other symptoms include changes in bowel habits and heartburn or retrosternal burning. Next, ectopic pregnancy. Lower abdominal pain may be sharp, dull, or cramping and constant or intermittent in ectopic pregnancy, a potentially life-threatening disorder. Vaginal bleeding, nausea, and vomiting may occur, along with urinary frequency, a tender adnexal mass, and a 1 to 2 months history of amenorrhea. Rupture of the fallopian tube produces sharp lower abdominal pain, which may radiate to the shoulders and neck and become extreme with cervical or adnexal palpation. Signs of shock, such as pallor, tachycardia, and hypotension, may also appear. Next, endometriosis. Constant, severe pain in the lower abdomen usually begins 5 to 7 days before the start of menses and may be aggravated by defecation. Depending on the location of ectopic tissue, the pain may be accompanied by constipation, abdominal tenderness, dysmenorrhea, dyspareunia, and deep sacral pain. Next, E. coli. E. coli 0157H7. Signs and symptoms include watery or bloody diarrhea, nausea, vomiting, fever, and abdominal cramps. In children younger than 5 and in elderly patients, hemolytic uremic syndrome may develop, and this may ultimately lead to acute renal failure. Next, gastric ulcer. Diffuse, gnawing, burning pain in the left upper quadrant or epigastric area commonly occurs 1 to 2 hours after meals and may be relieved by ingestion of food or antacids. Vague bloating and nausea after eating are common. Indigestion, weight change, anorexia, and episodes of gastrointestinal bleeding also occur. Next, gastritis. With acute gastritis, the patient experiences a rapid onset of abdominal pain that can range from mild epigastric discomfort to burning pain in the left upper quadrant. Other typical features of gastritis include belching, fever, malaise, anorexia, nausea, bloody or coffee ground vomitus, and melena. However, significant bleeding is unusual unless the patient has hemorrhagic gastritis. Next, gastroenteritis. Cramping or colicky abdominal pain, which can be diffuse, originates in the left upper quadrant and radiates or migrates to the other quadrants, usually in a peristaltic manner. It's accompanied by diarrhea, hyperactive bowel sounds, headache, myalgia, nausea, and vomiting. Next, heart failure. Right upper quadrant pain commonly accompanies heart failure's hallmarks, which are jugular vein distension, dyspnea, tachycardia, and peripheral edema. Other findings include nausea, vomiting, ascites, productive cough, crackles, cool extremities, and cyanotic nail beds. Clinical signs are numerous and vary according to the stage of the disease and amount of cardiovascular impairment. Next, hepatitis. Liver enlargement from any type of hepatitis causes discomfort or dull pain and tenderness in the right upper quadrant. Associated signs and symptoms may include dark urine, clay-colored stools, nausea, vomiting, anorexia, jaundice, malaise, and pruritus. And thank you very much for listening. This is the end of part 2 of our third entry in the Handbook of Signs and Symptoms. So I'm sorry, but I have to. It's a very long subject. I don't want my videos to be too long, so you can stop and rest, and also I can go back and revise. So we'll continue in part 3 about the other differential diagnosis of abdominal pain. Thank you very much for listening. Like, subscribe, comment, and please always be happy. Thank you.